Go. Hi, my name is Valley. I'm a student nurse at Rhode State College. I'm going to be inserting a tube into your bladder so your urine will flow more freely. Can you please tell me your name, your date of birth? Okay. So Gladys Overs, 4/21/37. I'm actually going to start off by washing my hands. And after she told me that, I'm going to compare it to my physician's orders. So Gladys Overs, 4/21/37. Gladys Overs, 4/21/37. I'm also going to check her wristband. Okay, perfect. And the physician's order says to insert indwelling catheter stat, so right now. Okay, are you allergic to anything? Any cleaning solutions, tape, latex, anything we should be aware of? Okay, she has no allergies at all. So I'm going to set this down. And I have these supplies here for perineal care for my patient. But in this case, she doesn't need it. So I'm actually just going to use this as my back blanket. I'm going to uncover her as little as possible, but I'm going to, just for this check off, I'm going to give you a little more area so you can see. Okay. So my patient's exposed. I'm going to drape her with her back blanket. Okay. And I have, she's covered. So this is going to actually be my flashlight today. I'm going to kind of place it to the side so that I can see the urethra more freely. So after that, I'm going to come over and remove my supplies. This is a sterile kit, so I need to be careful, but I'm going to be using this as a biohazard bag. I'm going to give it a couple cups. So I'll set that here down at the end near my flashlight. Okay, so this can go in the trash. It's just everything that's in my kit. So I'll put that over there. And I would make sure that I have a trash can in reach too. So I'm going to start off by turning this towards me, making sure not to touch anything. I'm going to clear my spot off so I don't. Okay, so I'm going to start off opening it away from myself. So I'll do that. I'll do my sides. And then making sure I'm not crossing over, I'm going to come over here and grab the back. There we go. So I'm going to push it over here to the side because I have a 1-inch margin that I'm allowed to use. Okay, so first off at the top we have our drape for our patient. It's sterile, so I'm going to grab it carefully by the corner. And I would let it open itself, making sure not to contaminate it. So I'm going to hold it above my waist and make sure that I don't cross over any fields over here. And I'm going to gently lay the shiny side down. So my patient. I'm going to slide it over, and I can adjust it, but I need to make sure not to touch the middle of it. Okay, so now we have our sterile gloves. I'm just going to grab them and set them over here. And I'm going to go ahead and put these on. Okay. So when I'm putting my sterile gloves on, I'm going to use my non-dominant hand to grab the cuff, only with using as least amount of my unsterile hand as possible. And I'm going to slowly take my time to find my thumb and my fingers, making sure not to cross over the sterile glove. So I can adjust it, but only using the cuff. Now with my sterile hand, I'm going to leave it above my waist using the T-Rex motion. I'm going to slide my sterile hand inside the cuff, kind of like expose it a little bit. And then using my fingers, I'm going to put my thumb at a 90-degree angle so as I can easily get my fingers in there. Okay. So now that that's on, I'm going to, since my hands are sterile, I'm going to leave them above my waist. And I'm going to put this over here so I can separate my kits. So in this top kit, I have my swabs, my lubrication jelly, and my sterile water. Okay, so what I'm going to do first in this situation is I'm going to take my water and attach it. And during this whole procedure, I need to make sure where my elbows and my hands are at all times. So I'm going to make sure that nothing touches besides my gloves. I'm going to uncap my sterile water. Okay. And attach it to my catheter. I'm going to get closer. So I found my port. I'm just going to make sure it's in there good. And there's that. Okay. Now I'm going to unwrap my catheter, making sure that I hold it kind of towards the end so it doesn't fly everywhere, because they're a little flimsy and I don't want it to contaminate itself. So after that, I'm going to just place this in the trash can over here, waist down. Okay. And I'm going to take my lubrication jelly. And if it were a normal patient, I would probably lubricate about 2 to 3 inches, but for right now, I'm just going to put a little dot. Okay. So I'll put my little dot on to allow easier access. Okay, so once my lubrication's on, there's that. I'm going to set this back in here. And I'm going to open my alcohol swab sticks. This is usually pretty easy to open, so I'm going to just carefully take it off. It's actually not that easy to open. Okay, so once it's off, I'm going to set these over here in the corner. Again, making sure my hands are in my T-Rex motion, not touching anything with my elbows. Okay, so now that that's done, I open my swabs and I'm going to take my kit and I'm going to come over to my patient and set it down in front of them, giving enough room to kind of see. So in doing this, I'm still sterile, so I need to make sure I'm not crossing over my field. So I'm going to take my non-dominant hand, I'm going to come over here and spread the labia. And I need to maintain the labia spread throughout this procedure. So I'm going to take one cotton swab, again making sure my elbow doesn't scratch or touch the thing. And I'm going to do the outside part of the urethra, farthest away, top to bottom, meatus to rectum. And after that's done, I'm going to toss it into my biohazard bag, get another one. And I'm going to do the part closest to me, the urethra closest to me. Top to bottom, meatus to rectum, toss. And lastly, I'm going to do middle. So I'm going to go top to bottom, toss. Okay, and I would not unseparate my labia. Now I'm going to grab my catheter and I'm going to be careful not to contaminate anything. I'm going to find the urethra and insert it until I see the urine flow. And once I see the urine flow, I'm going to insert it about 2 to 3 more inches. And then using my non-dominant hand, I'm going to grasp the catheter, making sure that it's very stable so it doesn't fall out or anything. I'm going to take my dominant hand and I'm slowly going to insert my sterile water. And I'm going to make sure my thumb doesn't come off until all the water is gone. Okay. And then after that, I'm going to tug my catheter a little bit and make sure that it's in. And it is in pretty good. Do you want to come over the top and see? So my catheter, the balloon is the balloon is full. So now I'm going to remove my saline, or my sterile water, discard of it in the sharps container. So the sharps container will be over here. And after that, I'm not sterile anymore, so I can remove I'm not going to remove them, but I'm not sterile anymore. Okay, so now after that's done, I can start, I'm going to actually attach my catheter. I'm going to unwind it, making sure that I don't tug on it or anything. I don't want to cause the patient any discomfort. So I'm going to attach my catheter to my patient. I actually have some tape here to do that. Tape go. There it is. And I'm actually going to make sure this is in the sterile box. So I don't want it to touch the bed or anything. Okay, so I'm going to get the tape. Since my patient said that he was not allergic to tape, I would just attach it with the tape. Let's say right here. Okay, so there we go. And it's attached. So now I'm going to attach this to the side of the bed. Again, I'm going to just use a piece of tape. Okay. So once it's attached to the side of the bed, I'm going to get another piece of tape to make sure that my patient is attached to my patient. Okay. So I'll get my tape. And I will attach that to my patient. Let's say that this is her leg. I'm going to attach it there. And I'm not going to put it under her leg. I'm going to put it over her leg. And I'm going to discard of my supplies. So I'll just put it for there right now. And I can throw my drape away. It's attached to my bedside now. And I'm going to drain any, first I'm going to discard of my biohazard. So the trash is right here. Throw away my flashlight, or put away my flashlight. I'm going to assist my patient down to a comfortable position and recover her. Okay. So I would make sure her call light's in reach, and now I'm going to come over and I'm going to get a graduated cylinder, which I don't have right now, but I'm going to pretend this is my graduated cylinder. And I have some alcohol swabs that I'm going to use to swab the opening for 15 seconds before I drain. And I would drain my specimen, measure it, document, and what I would document would probably be like the size of the catheter that we used, how much urine was drained, things like that. So after I empty the drain, I'm going to ask my patient like if she's comfortable, are you in any pain? And she stated no. So I would take my gloves off, discard of them, and wash my hands, and I would document.